All right, let's get started. Can I welcome all of you as development practitioners and colleagues to this this session, hot on the heels of Minister Conroy's opening address. My name's Andrew Egan. I work at DFAT. I head up our Development Performance and Advisory branch in the Development Effectiveness Division. I'll introduce our panelists for this results-based financing session in a minute, but the first thing I want to do is to acknowledge and celebrate the First Nations on whose traditional lands we meet this morning and pay our respects to the elders of the Ngunnawal people, past, present and emerging. Welcome again to this this session on results-based financing. We've got an esteemed panel that we've assembled to guide you through this session. On my right, I've got Ian Anderson, who many of you will know has had a long association with AusAid DFAT and the broader Australian Development Program, and has been doing some deep thinking around results-based financing that we've commissioned. To his right is Kirsten Hawke, the lead design specialist at DFAT in the Development Effectiveness Division. And up on the screen behind me is Sam Porter. He's a counsellor from our Jakarta embassy and has a key leadership role managing our economic, infrastructure and climate-related engagement in the Indonesia Development Program. Each of them are going to take on a different chunk of the, I don't know if that, can we get the slides up? A different chunk of the results-based financing. And the next one, no. There we go. So Ian is going to really set the scene and give you a bit of a stock take of the lessons that we're drawing from the global experience working on with different results-based financing modalities and mechanisms over many years. Kirsten is then going to talk through a more DFAT-specific set of reflections on our experience working with results-based financing mechanisms. And then Sam is going to sort of dive more deeply into the Indonesia experience, which, as many of you will probably know, has been one of the Australian Development Program sort of at the leading edge of experimenting with different results-based financing modalities. We're going to preserve as much time at the end for Q&A, so really look forward to a dynamic discussion. So as you're listening, please think of the kind of questions you want to throw at the panel, and we'll ensure that we engage in that kind of discussion in the second half of this session. Just a couple of quick introductory slides from me. I won't read this slide, but I will start by touching on where Minister Conroy started some of his reflections about the opportunity presented to Australia's engagement in Southeast Asia. He specifically referenced the clean energy transition and the huge investment required to support the energy transition in Southeast Asia, given the role that it's going to need to play in the global net zero transition. He referenced the fact that by 2030, at least $2 trillion of investment is going to be required in clean energy infrastructure across the region. This slide references World Bank estimates that suggest even larger sums of investment are going to be required in order to meet the sustainable development goals. I guess the headline point is a fairly obvious one. Public resources, be they resources mobilised by our partner country governments in the region, or public resources that are mobilised through official development assistance, the Australian Development Program and others, are going to be very insufficient to sort of meet the financing needs in the region, both in the Pacific and Southeast Asia. So this session is really motivated by the challenge of thinking about how we can use results-based financing modalities to crowd in greater investment to pursue development objectives. There are many definitions of results-based financing, and Ian no doubt will unpack these in more detail in his session. I guess the headline point from our perspective and from the panel's perspective is that we're really focused on how we can tie payments through the development program to the achievement of specific results in order to crowd in greater levels of investment beyond the scarce ODA dollars that we can provide through the development program to achieve those larger development results. There are a whole constellation and different array of results-based financing mechanisms, and I'm going to hand over to Ian, who's going to take you through how we're categorizing them for the purposes of this DFAT research that he's led, and then he'll take you through the next 15 minutes of the session. So Ian, over to you.
Well, good morning. Nice to see a lot of faces there that I know and friends. So yes, so we've seen the definition. So we'll start moving through these ones, and I should just mention at the outset that while I used to work in AAC for 25 years, I'm now independent consultant. So whatever I say at this stage does not necessarily represent DFAT. I'm going to go through these slides fairly quickly, partly because there's some good material in them, but you can look at those later on as a resource. So 20 different types, lots and lots of different types of issues dealing with different types of organisations. And the other part that's interesting is just the scale of it. So for example, the Asian Development Bank has $18 billion set aside for policy-based lending, $18 billion over a 2-year period for Asia and the Pacific. The World Bank says that it spends about $2.5 billion on primary healthcare since 2020. And the Millennium Challenge Corporation, which is this big United States organization set up specifically just to deal with incentives, has spent $13 billion on results-based financing. So, you know, then it's not a niche area. This is quite a big and important area. So the key applications, it's not new. Many people remember managing for development results things. Many different terms that have been used: cash on delivery, development linked indicators, blah, blah, blah. Many sectors: health, road maintenance, deforestation, governance, electricity, disaster preparedness. Many countries, and as we'll see some from the case studies, fragile and conflict affected countries as well. Many organisations, multilateral development banks, etc. And this is an important issue. It is always different to the old hard conditionality. You remember from sometimes people would talk about the way the IMF would force a country to do things almost against its will. This is the opposite. This is saying you as a country want to do this, or you as a community want to do it. How do we accelerate it? So here's the theory. So, because this is the classic old sort of project line of project logic, and you can use your financing and contracting at any point along this spectrum. So look at the first line, vocational skills training. Well, you could start to pay simply the trainers in the hope that they then do the training received. But what happens if some of the attendees go straight away after lunch and they don't turn up? So that's not going to help. Or what happens if they do go to the training and it's all theoretical and they don't actually learn anything? So the output hasn't really been achieved, or the outcome. So there's some way of working out along this project logic How do we actually find the best spot to contract and to pay? So here's a good example that I find very sort of convincing, because it's dealing with the missing links in the chain. And the first example is measles immunisation. And you can see it's the old traffic light story. So here we are, we know that there's been 128,000 deaths of measles, and we've now had the lowest level of measles in 14 years of measles protection because of COVID. So if we move along the logic chain, it should be getting stronger and stronger, hence the green. So the starting point in a developing country often is, I'm a bit nervous about this one, because is there going to be supply chain availability? Will the vaccines turn up? Will I have the money to get on the motorcycles to go out to the village? So that's where the hesitation starts. But as you move along, and especially by the time you get to here, and you actually put the needle in the child's arm, you have a 97% chance, probability, that that child will not get severe measles or die. The science is just telling you that. So that's where you can say, we'll pay you to do that. How you do it, when you do it, how you involve, it's entirely up to you. And that gives the NGOs the capacity to be flexible, et cetera, et cetera. Now, what about a reverse situation where you start off with very, very strong assumptions and they all turn to dust? So, for example, I decide that I'm going to win Eurovision Song Contest and I'm going to apply for it. Why? Well, I'm an extrovert. I can play 3 chords on a guitar, playing Wiggle songs for grandchildren. All I need is a sparkly jumpsuit and some smoke bombs going off in the background. Then I'm going to win. It's clear. So there I am, very confident. The next step is I have to find my guitar, buy the sparkly costume, the smoke bombs, and I apply. Then I sing the well-known song, Achy Breaky Heart, everybody's favourite. But you can see that it's starting to wobble. The assumptions and the logic chain is just starting to wobble. And then when I actually do the performance, stunned silence from the judges, and I get a 0 score. And the interesting part is, what is the impact? Because my assumption was so strong up here, I don't think it's got anything to do with me. It must have been the silly jumpsuit that I bought, or maybe the wrong song. And so the point of this is, if we start off with very strong evidence at this level, it's likely to work very well. But if you're a bit of a goose with strong assumptions that aren't applying, problems. This is a very big, complicated slide. I won't go into the issue of it. I thought some people would be interested in the fact that this is dealing with a regional program for pandemic preparedness. I know a lot of people are interested in that. You can see there's a lot of interactions. That's useful. And the other part that I find very useful, what was the impact? Public health improvements in the region, good, but cost savings realised in public health systems. And that to me is a very clever, shrewd, politically savvy impact to get out of results-based financing. You save scarce public money. That's a World Bank slide. So this is the famous story about the principal and the agent. The principal is the person who sort of commissions the exercise. The agent is the one who does it. And there is always the problem that the principal, for example, DFAT at a country level, may not know exactly what the agent, the contractor, is actually doing. And so you can see there's possibilities. There's a lot of theory about how you solve that problem, and we can talk about that later. But the basic line is having a shared contract involves trade-offs, but benefits. We can talk about that later. So what are the arguments in favour of results-based financing? It's generally more effective. Why? Because it focuses on actual results and tangible results. It's certainly more adaptable and nimble because you're not following a blueprint. You're saying you get the results the way you can best do it yourselves. And it balances risk and reward to those who are best capable of managing them. It's generally more efficient because it incentivizes innovation and reduces waste, less transaction costs, less bureaucracy, less micromanagement, and certainly there's a possibility of reduced corruption. And in general, it's more equitable because there's better incentives for stakeholder consultation. And we'll talk about that in the case studies. So some practical examples. This is one of my favorites. So this is a situation in Bangladesh in the 1980s, large numbers of children dying from diarrhea. And so there was no alternative which was going to be sort of efficient. So what they did was they trained the community health workers to go out and train these illiterate mothers to look for the symptoms. So they trained them. They found that it was not getting traction. The way to get traction was to say, we will pay you, community health worker, if we come through as an independent group and test that the mothers themselves can mix the oral rehydration salts. You'll get paid. And the beauty of the story was that straight away these well-intentioned health workers said, I'll have to change the way I teach this. Instead of being a lecturer at the front, we'll have to get the women to stand up and each one practice. And sort of almost overnight, the thing changed because they reflected about the way they were doing things. And so the key results, effective, 90% of mothers scored the correct answers and they prepared the salts. Efficient, it was 75 cents per household to get to that level. Equity, most of those women were illiterate and the results were achieved at scale, 12 million households. Another one, Samoa Power Project, usual problem, power not very efficient, dropouts, blah, blah, blah. So the Asian Development Bank provided $119 million. It was already a concessional loan, but there was policy reform, there was program reform, all these other things had to happen. How do you incentivize the Ministry of Finance to do it? Australia said, we will provide $4 million grant if you actually achieve all these policy reforms. And we'll pay it at the end to further reduce the loan. And so that incentivized everybody. Everybody's aligned with this. And it increased the major outcomes were achieved. Economic internal rate of return of 16%, very high. The powerful Ministry of Finance was incentivized further because it reduced their country's debt. And for a very small amount of financing, 6.5% of the total, Australia achieved this and leveraged it. Another example. So this is expanding sexual and reproductive health in 15 countries of Asia, South Asia and Africa, mainly through IPPF. Problem statement, typical issues of difficulty in accessing safe and reliable sexual and reproductive health, and all of those issues, SDGs were affected. Payment for specific results, and look at the results. Outcomes at scale, 23 million years of contraceptive use partners and additional users. Equity, because youth and underserved were achieved. And there was a clever design feature in the sense that no country should get an increase of 40%. So you didn't just cherry pick the easy countries, you had to keep spreading it in the difficult countries as well. And it captured the cost savings, $965 million Australian to the public health system was saved. I mean, this is a very clever way of incentivizing other development partners and ministries of finance. And this is my last example. This is a very interesting one as well. Late 1990s, there's a war on drugs in Colombia. So the price of coca went up to make cocaine. Farmers in neighboring Peru said, well, we can use this as an incentive to get some money. And they used their children to harvest the cocoa because the children couldn't be prosecuted because they're under 12 years of age. So this very clever anthropologist noticed that the child labour rate increased by 30%, 26% drop out of schools. So they paid people $30 a month to make sure that your children actually stayed at school and didn't pick coca. Coca production fell 34% in the intervention areas. The lifetime pathway to crime was reduced. And the way the Economist magazines summarised it, given the high cost and low impact of other anti-drug policies, this intervention of results-based financing was a bargain. And as an economist, I think this is one of the best definitions of what economics is all about. The best use of scarce resources against competing alternatives. I mean, it's a lovely story because it tells you how difficult this was, crime prevention, and it stopped children moving on to a pathway of crime. So what goes wrong? Oops, tricks, traps, and unintended consequences. So we sometimes don't specify the right problem. So we're trying to improve public hygiene. We have a water and sanitation project. But the real problem, the binding constraint, was not so much lack of water, although that was a problem, it was that people don't have soap to wash their hands. The very final step was the issue. So we don't specify the binding constraint. This is a sad one. In many cases, the people, the stakeholders, the government or the community does have the incentive to improve things, but they don't have the authority to change resources. And so we are pushing on a string to get anything done. Fraud, people can easily, game the system by setting up low standards to achieve, or sometimes it's too complex. So even our friends in the Global Fund, which is parading the fact that they use incentive-based financing, 34% of countries that were dealing with it said it's just too complex. We just don't get the incentive. And if it puts a focus on quick wins, it can undermine institutional strengthening and confounding factors. So the UK had a program in Africa which said, we're going to pay if there's an increase in the number of children going to school. Sounds pretty good. What they had not realised was that there was such a bulge in the population coming through, there was a cohort, it was going to happen anyway. Going to happen. So unintended consequences, the sad story, this is a classic story in Africa, that often, the local health clinic keeps on running out of drugs, okay? Went into the health clinic and said, we will pay you as managers if you can manage your health and drug supply properly, so that there's not a drug stock out. You'll get extra bonuses. Came back 3 months later, stocks are full, everything's going well. That's very good. Congratulations, how did you do it? Well, we just stopped giving the drugs to the patients. I mean, human beings are just fascinating. And if we pay people not to have drugs on the shelves, people won't get the drugs. It's an unintended consequence. It can displace cooperative behaviour. There's a very famous story about people used to, use their social conscience to say, oh, look, we can't pick up the children late from school. Then they started paying a fine and they said, gee, now we just pay for it. This is fantastic. We can be really late. And there's other examples like that. So this then is now for Kirsten to take over. Thank you for your time.
Morning, everyone. Ian's given us a tour through the global sort of literature through his research and some case studies. I'm going to bring you back to Australia and DFAT's experience with results-based financing. And I know there's some people in the room who've managed some of these projects, so please jump in during the Q&A. So I've only got 2 slides, but my main thing is reflecting on our portfolio. We've got about 35 investments across DFAT's portfolio that have some kind of results-based financing instrument. But we've also done a deep dive into 8 case studies. So a lot of the lessons that I'm talking to today are from those. I think the key takeaway when I'm thinking about sort of the conclusions, drawing from, the observations of our portfolio, is I kind of had the image of, with results-based financing of, you know, there's dance machines at the arcade. So when you step on them, certain things light up. It's a bit like that with the theory of change that Ian had up on the screen. Results-based financing won't necessarily light up the whole chain, but bits of it, depending on, you know, whether you're striving for effectiveness or efficiency, what the change pathway is. So yeah, it'll catalyze bits of the pathway within the theory of change. It's definitely more successful when it goes with the political will rather than against the grain. That's another key takeout from us. We have had results-based financing instruments that are there to manage risk. So I can think of one where we were trying to really focus on primary education in a country, and they were moving all their money to tertiary and scholarships. And so the results-based financing instrument was trying to reward co-financing in primary education. So that worked for a number of years, but if it's going against like a whole number of MPs that want to work in a different direction, it's quite hard to stop that change. It's really about, and where it works better is where it's catalysing a reform and getting behind local leaders with those reforms. And as Ian said, just adding the catalyst to that and accelerating that process. I think the other major benefit we're seeing across our portfolio is just that ability to leverage substantial finance. So whether it's budget support through partner systems or whether it's working directly with the private sector, it's really about leveraging that finance. We've even got case studies with NGOs partnering up with state governments that are able to leverage a whole lot of state government funds. So just that ability to take projects to scale is really important. The other key critical issue around sustainability with results-based financing instruments is they're more successful when they're supported within a set of enabling institutions, so say subnational governments, or whether they're building a new market system. And I've got some great examples to show you of that soon. And the other key message is, you know, if you look back at the theory of results-based financing and when it started, it's about sort of 15 years old, but it's really been informed by behavioural economics and that idea of nudging in terms of behaviour. But extrinsic motivation, or that additional like money talks and it gives you that additional motivation, but it can't replace intrinsic motivation. It really is additional to it. So intrinsic motivation are things like often driven by social norms. They're driven by, you know, people's connection with community, pride, reputation, those sorts of things. Extrinsic motivation can't replace intrinsic, but it absolutely can add to it. And so that's what's really important. And where the results-based financing instrument is, it's got to act as that incentive. So it might sound obvious to say this, but the incentive needs to be a carrot and not a stick. So we do have examples that I'll come to later in the lessons where the partner has sometimes seen that incentive is a stick rather than a genuine carrot, and therefore a punishment if a payment's withheld. So we'll look at that soon. In terms of some key examples, so I think my colleague Sam's going to talk to the first one, so I'm not going to go on about this one, but I think Kiat and Prim are our roads HIBA programs in Indonesia. HIBA means grant in Bahasa. And we've looked at the quality scores across DFAT's portfolio to pick these ones out. So he's going to talk to that. But I think the key there is the programs are highly effective and efficient. And he'll talk to how we've taken them to scale and how they're working in terms of driving quality at subnational level. There is a separate water HIBA in Indonesia and a separate sanitation HIBA. And the water HIBA is also highly successful, but the sanitation HIBA is slightly less successful. So it's still taken to scale, but it's slower. And what's interesting about that case is there's less political will because it's less tangible. There's less sort of MPs campaigning on sanitation. And sort of less tangibility in terms of people's demand for sanitation services. So I think it's a really nice example of when you look at the HIBA model and why it's so successful, but yet, you know, roads and water have been and drinking water have been so much more successful than sanitation, and why that is. Another example that stands out, I know there's officers in the room who've managed this program, is the Cambodia Health Program, which is a partnership between ourselves and the World Bank. So I think here the real success of this program was around efficiency and sustainability. So essentially there was core funding that went out to health clinics that was based on them meeting certain minimum service standards. And then there was a performance-based grant across the top. And something like over time, 60 to 70% of clinics ended up meeting those standards and getting the payment. And some of the transformational impacts are quite profound in terms of increased access to services, reduced out-of-pocket costs, lower patient waiting times and that sort of thing. So yeah, quite a remarkable program. And I think in terms of political will, there wasn't really a huge, sort of social contract around health when the program started, but over the 8 to 10 years that shifted and there was a lot more support from the government for the provision of health services. And then they were campaigning on health, during the election. So there was that shift over time as health became more important. Final example from our portfolio is working directly with the private sector. So we've got the Emerging Markets Fund and Investing in Women. Really interesting programs. Investing in Women's a bit more mature because it's about 6 years in, whereas EMF's about 3 years in. But they both have an innovative, essentially a bargain with the private sector that we share profits. So if they meet their gender lens investing goals, they get a higher management fees and a higher share of the profits. So Investing in Women has partnerships with 10 impact funds across Asia. And EMF works directly with much smaller sort of venture capital funds at more the micro SME end. But yeah, both have substantially changing the culture around markets and the way that investment brokers are working with women-led SMEs. So it's quite exciting. They've also leveraged a lot of money. So I think for 20 million in Investing in Women, we've leveraged more than 220 million. And EMF's still small. It's in that $20 to $40 million range, but it's going to be taken to scale soon. So gender lens investing is quite exciting, but they're looking to move into the climate space more as well. So yeah, we can incentivize equity, but we can also incentivize climate. So next slide, please. So just some do's and don'ts and takeaways, and these came from a lot of our staff and our qualitative interviews. So some of these are pretty, reasonable takeouts, things like target critical constraints. Like that's as a design person, I can say that's a pretty important thing to do regardless. But essentially we want to target the right problems and have a deep problem analysis shared with our partners and have a shared vision of success. Mock out a reform pathway, but of course it needs to be highly adaptive, and then put verification and triggers in place that'll stimulate that pathway. And of course adapt and adjust as we need to. It's all about co-design. Like, as Ian said, this is not about 1980s structural adjustment conditionality, right? It's absolutely about partnership. It's about accelerating where partners want to take their own reform agendas and getting behind champions of change in the country. So it's all about local leadership. I think it goes very, very well with localization. The main sort of do's and don'ts is to not be so ambitious that you're spreading yourself really thinly, and you've got to stay within the span of control within the partner. So in government terms, we always say, don't mix up, central agency reform with line agency reform or service delivery. Make sure that the areas of reform are within the span of control. Have that long view, don't just go for one-off things or one-off change, go for a long view with multi-year reforms. Incentivize the right people who are making the decisions, but also the beneficiaries, like the staff themselves. So one of the nice examples with Cambodia Health, that I think part of the performance-based agreement was allowed to be moved to the staff for bonus payments. So that was a huge incentive for them. Donor coordination, if we are doing things in coalition with other donors, to absolutely coordinate, because it minimises the transaction costs and come up with shared plans of action and shared triggers. And it's good for governments too, because then they get multiple payments from donors for the same trigger. So it works from them in terms of transaction costs. The other key lesson is to not just have a whole bunch of really ambitious indicators. I mentioned the spreading thinly point before, but some of the core areas are more about just incentivizing good management and good behaviour, good reporting, good finance, good HR systems. And then you want to have a whole lot of stretch indicators that are meaningful. But make sure that's the right balance. When you're in times of crisis like COVID, you might just want to pull right back and consolidate and just focus on core areas. Additionality is a key one as well. Like make sure your money's genuinely additional. So I mentioned the Solomon's education one before. So when you are putting your money into, say, primary education, make sure and you're putting results-based financing around it, make sure that the government's not moving all of its money out. And I think we had a similar situation in other countries. If that leads to fungibility, and then we're not actually genuinely additional in those cases. So it's kind of the 101, but you'd be surprised how, sometimes these things happen. We've really got to manage the risks. So yeah, I mentioned before that make sure it's a genuine top up. So whether it's people know they're getting the 90% of the payment, just the top up is the 10% or the 20%, whatever you've negotiated, but make sure they know they're still getting a base payment. You wouldn't want to have the whole 100% based on results. That would drive too much uncertainty for the partner. And I mentioned the carrots, not sticks before. Make sure it's genuinely a reward and not a punishment. Size matters. I talk here about Goldilocks zones, things to get right, not too heavy, not too light, just right. Size matters. The incentive needs to be large enough to be an incentive, but not too small to be a disincentive. So we've had situations in some of the smaller Pacific Island countries where the payment's just been too small to really justify the transaction costs. And then sometimes people have had a lot of money and then the incentive isn't quite enough of an incentive. So yeah, just that amount of money really does matter. Flexibility, so allow partial payments. So if the partner's made a really good effort and made 50% of the reforms under difficult circumstances, then allow for 50% of the payment. So allowing for that and being timely about it. We've got a really nice partnership with SPC ECAP, which is, I think, Education Quality Assessment Program. And one of the things SPC really value about their partnership with DFAT is the partial payments aspects and the timeliness of it. I mentioned keeping focused and around a small number of areas of reform, consistency and progression. And then M&E. So monitoring and evaluation is always important, right? Specifically when you've got particular triggers that need to be verified. So we definitely need baselines. We want to use partner M&E as much as possible and invest in their own data sets. For DFAT, our reflection is that we want to use third-party assessors because we don't want to pit ourselves against a partner and say, well, you haven't done this or you haven't done that. It's good to have an independent person that does that brokering. And then we can have a more, distance policy dialogue discussion. And then reflection and dialogue, data, learning, it's all about learning, and it's not about, one partner reforming in Australia and going, we do it this way. We're all on a journey around reform, around climate, around wicked policy problems, partnering with NGOs, extending the reach of the state in difficult areas, targeting marginalised groups. All governments have the same wicked policy problems. And so we're all genuinely learning about what works in different contexts. So to use the data, the financing, to have that dialogue and that cross-learning. Yeah, so those are just some takeouts from DFAT. And I think we're over to Sam next.
So Sam, you're on screen and you're ready to go. I think everyone's eagerly awaiting the deep dive into the Indonesia experience. Over to you.
Wonderful. Thanks, Andrew. Just testing you can hear me.
Loud and clear.
Brilliant. Well, good morning, everybody. Great to join you this morning. It's pagi here in Jakarta, but good to really good to join this panel. As Kirsten and Ian and Andrew have said, I think the HEBA or grants programs in Indonesia are some of the best examples that DFAT has in its portfolio of results-based financing. Definitely a shout out at the start to, of course, our government of Indonesia partners in the central and provincial governments who really do the hard work to make these programs happen, but also to, I'm sure there's lots of people in the audience who have had some association with these programs over the years, probably a lot longer than me. So acknowledgement of all your hard work as well. I'm just going to riff off the themes of the paper and just talk about the what, the why, the how, and then a bit of the impact of PRIM. I can't see the slides, Andrew, but if you're on the slide that says Provincial Road Improvement and Maintenance Program, the next one. Yep, that's it. Thank you. So I'll give a bit of a explainer at the start. What is PRIM? So the Provincial Roads Improvement Program. So it's a results-based financing program that's housed within KIAT, which is Australia's big infrastructure facility in Indonesia. And as Kirsten said, it's one of actually 3 results-based financing programs that we run in water, sanitation, and roads. And all of these programs have got a really long history. So, you know, PRIM can really trace its origins back to Australia's response to the Boxing Day tsunami. You know, the INREP Eastern Indonesia Roads program that was set up after that. And the kind of learnings from that program really led to the development of PRIM, which was designed in 2012 and started in 2013. So it was actually requested by the government of Indonesia. So they asked Australia to work on a mechanism that could activate a performance-based financing grant that was regulated within the Indonesian system, but rarely used. So in a sense, we were kind of activating a part of the Indonesian budget system that hadn't been used in the past. And PRIM provides a couple of things. So it provides TA to improve the planning and quality of road maintenance, and importantly, working within provincial budget constraints. So as Ian said, making the best use of scarce resources, that's the challenge at all times. And PRIM helps governments try to do that. And then sitting alongside the TA, it provides reimbursable grants for quality maintenance work. So there's the 2 arms. And the 2 things put together are really supposed to provide much stronger incentives for road maintenance. So that's the overall purpose. So I'll go into some more of the mechanics later on, but really just to summarize, you know, if the provincial governments complete a set of maintenance and rehabilitation works to a verified standard, the central government will then reimburse the provincial government with a grant. It's a DFAT funded grant that's held in trust by the Ministry of Finance until the verification is completed. And really, you know, I think the overall purpose was to trial this new way. It's using scarce donor grant funding to trial innovation. It's the type of innovation which is, you know, it's difficult for the Indonesian government to spend its own scarce tax money on that type of innovation. So that's, you know, it's a really good role that Australia as a donor can play in Indonesia. So that's a little bit about the what. I might talk now a little bit about the why, like why do we want to run this program? I mean, I think Egan and Kirsten have really outlined all the reasons why you'd want to run a program like this. You know, obviously the headline development problem that PRIM is trying to address is poor quality subnational roads. So that's the surface level problem, and won't go into much detail, but obviously poor quality roads, it costs more to get produce to markets, it's harder to access government services. So look, we know all those things. That's the kind of surface level problem. But, you know, digging underneath a little bit, I think you can see budgets for road maintenance are limited. You know, the capacity to plan effective maintenance is low. And when maintenance is carried out, the quality of maintenance works is often very poor. So that's a little bit more detail on the problem. But I think to understand it further, it's good to recap on a little bit of the context, a bit of the Indonesian context. So on financing, you know, financing, like Indonesian government financing is available, but it's scarce. So it's a country with a tax to GDP ratio of under 10%. It's very low, which means, you know, our role as a development partner is really to work with Indonesia to help it use its own funds more effectively. And compared to lots of other countries where DFAT works, there is a reasonable level, a pretty strong level of bureaucratic capability, particularly in the central government. So you've got really engaged and technically savvy government counterparts to work with. The second part of the context is really about Indonesia's governance system. So it's obviously a country run with administrative and fiscal decentralization. Way too complex of a story to go into now, but, you know, to summarize, really it's the provincial and local governments who deliver most basic services, but it's the central government who generates most of the revenue. So services are assigned to the central and provincial, and revenue collection is mostly assigned to the centre. And that means that the main funding sources for provincial and local governments are intergovernmental fiscal transfers. That's really the main funding source. So clearly then you've got what Egan described as like a classic principal agent problem, where you've got the central government funding services delivered by the provincial and local governments, but the central government only has partial or limited control over the delivery of those services, either the outputs or the outcomes. So all of this really means that there's very strong incentives at the centre to improve the quality of spending, and that comes from both the line agencies like the Ministry of Public Works and Housing, but also importantly from the Ministry of Finance. You've got a real ally that's really trying to improve the quality of spending in provincial and local governments, and that's the grain that we're going with in this program. So I might go to the next slide, please. Thanks a lot. So I'll dive in now, give you a quick summary of exactly how PRIM works, just to make this really practical. So there's kind of 5 steps you can see at the top of the slides. The first one, planning and programming. So part of PRIM is working with provincial and local governments. A new IT system was developed as a program, and it's really just helping to plan out when road maintenance work should occur. And again, just trying to get the best bang, help provincial governments get the best bang for their buck from their maintenance budgets. So that's the first step. The second step is budgeting, and this is really important. So the maintenance works are actually budgeted as part of the provincial government's budget. So they're planned for and budgeted in the normal, just as part of the normal budget process. And the provincial governments actually prepay for the work, and they're then reimbursed later. So that means that that just kind of regularizes, the concept of doing regular maintenance. It gets built into budget patterns, and that's really seen as a key part of the sustainability of the program. The next step is the implementation. Obviously, procurement's done. The program provides support around procurement to try and lift the quality of procurement. The works are completed. And then sitting alongside the implementation is a really important part, which is trying to raise the level of public scrutiny of the delivery of this service. So again, Indonesia has a law mandating that each provincial area should run road traffic and transport forums. These are community forums that can engage local governments on road and traffic issues. The forums are rarely up and running, so the program worked with local governments to get these forums up and running in different areas, and that really provided an avenue for public scrutiny of the maintenance plans and the maintenance works. And again, through the program, that was really seen as a way to kind of lift the quality of work, as well as really importantly, providing a really tangible opportunity to raise the profile of women, and also raise the profile of people with a disability and disabled persons organisations, give them a chance to really input into the planning and implementation of these road works. So that was also seen as a really important innovation. Next 2 steps, the works are then verified. Have they met the agreed standards, yes or no? And then the last step, if the works are verified, then the grant payment is then released from the central government, from the Ministry of Finance, over to the provincial government. So that's the process. That's how it works in practice. Seems pretty simple. It's a little bit more complicated than on this slide, but yes, now we can go, Andrew, to the next slide, to the impacts. So this is just some quick photos and before or afters. Obviously, the bottom row of photos is the after shots. So you can see much higher quality roads, road safety markings, and some other features which really increase the accessibility of the roads for all members of the community. So that's a few live action shots. Maybe go to the next slide. And just to talk quickly for a minute or two on the achievements. I mean, I think generally PRIM has been regarded as a really successful pilot. So it's encouraged significant institutional reform, and the really intense capacity building efforts that have gone alongside it have resulted in a real step change in local technical and managerial capacity. I won't rattle off all the figures, but really good improvements in the road conditions and quality in each of the areas. So, the headline is that, road maintenance works under this program were delivered at a higher quality and at a reduced cost. So we were able to demonstrate to the Indonesian government that even accounting for all the inputs into the program, the TA and the other things that wrapped around, we were still able to deliver these road maintenance works at a lower cost and a higher quality than alternative methods. So that's obviously really, really compelling. Another really big impact is around Gen Z and social inclusion. So really, I think PRIM trialled these different ways through this Road Traffic and Transport Forum to really engage civil society and really increase the participation of women in decision making. And that was demonstrated to really impact the way that these road maintenance works were carried out, which roads were prioritised at what time, the road safety markings and other features that are important to the community. So that was seen as a really good achievement of the program as well. And then the last point I'll talk about is just on the institutionalisation. So, when I said at the start that the overall purpose of this is to use scarce DFAT grant funding to innovate, to trial something new, and in the hope that it can be scaled up. And PRIM's got two ways that it's doing that. The first was actually 3 years ago, the government of Indonesia decided to set up its own special purpose road fund, so modelled on PRIM, but completely using government of Indonesia funding. And that program's worth 85 million Australian per year now. So there's 85 million Australian per year of the Indonesian government budget that goes into capital works on a program that's designed around PRIM principles. And that's a special purpose road fund that the Indonesian government has used to support high quality roads in its strategic tourism destinations. So you might have heard of the 10 New Balis, which is the Indonesian government's strategy to spread the tourism dollar outside of Bali. So the PHJD program, that's the Indonesian government program, it supports high quality road maintenance. So linking back to some of Kirsten's comments about going with the grain, I mean, that's obviously a really cannily designed program where we're scaling up these principles from PRIM in a program that's really politically high profile and is delivering high quality results or high quality roads in these very high profile locations. And CARE's continued to support the government of Indonesia implement that program. So that's the kind of first step of institutionalisation. Then there's a second really important step that's going on as well. And that is ongoing discussion about taking the principles of PRIM and mainstreaming them through the much bigger intergovernmental fiscal transfers that occur every year between the central government and local government for local roadworks. So it's around $1 billion Australian dollars a year of funding goes from the centre to the provinces. That's part of a funding stream whose purpose is actually fiscal equalisation. So it's not a performance-based funding stream. It's sort of like the way in Australia that we compensate the states for the GST revenue. So it's a much more complicated endeavour to try and introduce performance, like performance measurements, performance results into that funding stream. So that's an ongoing discussion between the Embassy and the CARE program, the Ministry of Finance, the Ministry of Public Works and some others. There's already been agreement to mainstream some of the principles of PRIM into that funding stream, and there's a longer conversation going on about whether we can mainstream the rest of the principles as well. So if we do, that's a really significant achievement, impacting a funding stream of $1 billion Australian dollars a year. So so that's that's probably as much as I need to say. Just to say that, yeah, I think this has been, I think the Prim story, that was a lot of detail, but I think the Prim story is this really good example of the results-based financing. I think some of the characteristics of why it's been successful, partly it's longevity. I mean, we've been working in the Indonesian subnational road sector for a long, long time. I think this is the 3rd decade, and part of the trust and the relationships that we've built up, really feed into the success of the program. So I think I'll just conclude there and hand back to you, Andrew, and look forward to the questions.
Great, thank you very much, Sam. That was fascinating. Insights into Prim and the broader Indonesian program engagement. So thank you to Ian, Kirsten and Sam for speaking fairly crisply and succinctly. We've got over half an hour, or about half an hour now for Q&A. We've got a microphone that will come round. Can I, if we get a chance to build on, if someone wants to build on a question that's already been asked, stick your hand up and we might get 2 or 3 questions reinforcing each other. So Anna, I saw your hand up first, so we'll go to you.
Thanks so much to the panel. That was just, incredibly rich. I just have a question, I guess, that kind of goes more to DFAT's own political economy and sometimes the contradictory drivers that there can be between different aspects. And I guess I'm drawing particularly from our experience on the Vanuatu Skills Partnership, where we had set up a pilot initiative of establishing provincial skills centres in 2 provinces, and to kind of demonstrate the effectiveness of what decentralised skills training service delivery could look like. The whole point of that was to model that, build demand for that, which we managed to do successfully. But our whole strategic approach was therefore to build enough government demand that that they would therefore want additional skill centres in the other 4 provinces, but then we would be in a position, because the demand was strong, to be able to say, well, we won't, as the Australian government program, we won't fund those additional skills centres until you start paying the staff in those centres through the Public Service Commission. So building that sustainability. That was at our kind of strategic program level. At the, let's say, diplomatic level, obviously ministers were putting pressure on the High Commission to, we like these skill centres, we want, fund and, in the province where the then Prime Minister came from, fund another centre. So then as the team leader, I was getting pressure to spend our money and fund that new centre in that new province, when we then had to beg with the, poor First Secretary saying, but if we do that, we break the whole sustainability of the model. And thankfully, we have the First Secretary sitting here who was able to stand up to, but it did actually, it was a battle in the sense that there was so much pressure coming from within DFAT. So actually where that was going to be blown was potentially from the donor. And because of those very understandable different incentives internally. So I guess I'm just wanting to ask if you've had those experiences and how you do, how you've managed that to kind of almost in an educative way, I guess, that the transformational results are more, compelling than the transactional ones. But just really interested in your experiences if you've had similar ones.
Thanks, Anna. Can I just invite anyone from the floor that wants to ask a related question, particularly about, donor behaviour to make this kind of modality effective? Please.
Thank you very much for a very informative presentation and from all sectors. I'm Arushi Thurwe. I'm an education finance and planning specialist and doing exactly same research in the education sector at the middle level. And building building up on your question, the challenge that we have seen in the research is exactly this, the capacity of all stakeholders to understand the exact logic chain that you presented on which elements need to be incentivized, what results need to be taken into consideration. So my question was, with other sectors in education, it hasn't been very successful, but in other sectors, what experience have you had in building that buy-in and consensus and educating stakeholders at the donor level and at the local level on what is the benefit and the long-term planning with RBF? Thank you.
Thank you. Benita, you want to come in here, and then I will turn back to the panel.
I'm one of the people in the room. My name's Benita Somerville. I'm one of the people in the room that worked on the Cambodia program. And one of the, I do get what you're saying around the donor actions. And one of the things that we found really key and crucial in the Cambodia program was to have our red lines of what absolutely had to happen, because this was not happening over 1 year or 2 years. It was happening over 15 years. So we sort of had to keep our eye on the main game. What is it, the core things that we wanted to see, but allow flexibility around the edges. So there were some things that could change and, you know, be a bit different or whatever, or move with the times, but there were some core things that absolutely had to happen, and they were our red lines. And if, you know, and all the donors basically agreed on what they were. And then when we worked with the Ministry of Health and Ministry of Economy and Finance, we just let them know what those red lines were, saying, look, we're going to stay the course, but these things are what we have to see and have happen. And that was agreed. And I think having that up front and being really clear on that was crucial for getting that program across the line, and getting the really good results that we saw. Thanks.
Thanks, Benita. You've done the panel's job by answering Anna's question. But no, I think who wants to tackle the political economy of DFAT question? Ian, as an external, do you want to offer a provocative view, and then maybe Kirsten and or Sam?
Yeah, so I mean, we do have programs that get political requests, but I was just trying to say is that, you know, I was just trying to link it to results-based financing, and there's no real correlation there. I mean, I just think that's something that posted officers need to manage. I think when I've managed results-based financing programs, the politics has been around what I call elite politics. So, you know, like when you're managing service delivery programs, you're very focused on either primary health or primary education. The elite or the MPs will often be really fighting hard for tertiary scholarships or for tertiary health, hospitals, Medivacs. So it's that kind of dynamic within a subsector that I've definitely felt. And just having, doing that as a donor group, working very closely with the bureaucracy, because the bureaucracy and the stakeholders and the NGOs, they're all for, you know, the utilitarian nature of service delivery and, you know, reaching people that need things the most. So it's just about working within the political dynamics within the community, I guess, and making sure that your reforms really do target those things so that you're countering some of those sort of what I call those elite perspectives. I'm not saying they're wrong. I'm just saying they need to be countered. There's a lot of, you know, much higher cost per head to be going down that pathway, particularly in service delivery, and you can get a lot more bang for your buck by, you know, by vaccinating children and doing all the health prevention work, etc. So yeah, more from a programmatic point of view, I think you can work through the politics, through the policy debates and dialogue. Your case, Anna, it sounds difficult. I don't know if you'd injected results-based financing into your scenario, would it possibly have given you a different lever? Possibly. The other where I've seen results-based financing work too is where you've got a national dynamic and you want to kind of catalyze the provincial. So actually sometimes sending results-based financing to the provinces. So maybe if you'd been able to broker an agreement with those 4 provinces where the skills centres were, given them some money and some triggers, possibly that might have just helped with that dynamic. I'm not sure, just talking out loud. Thanks.
I would add to this issue about the political economy. I mean, it does get down to incentives, doesn't it? And so that in turn means who are the people that we are interacting with, who are the power sources within the partner government. And it's often the Ministry of Finance. And I recall this very sort of instructive experience that I had, that I was with a big organisation which was presenting how much, if the Department of Finance provided more funding to particularly primary healthcare, this is the number of children's lives could be saved. And they had a fantastic presentation. and they gave it to the Ministry of Finance. And you could just see that the Ministry of Finance official was just increasingly getting disengaged. And at the end of it, he sort of unfolded his arms and said, albeit with a little twinkle in his eye, I'm not here to save lives, I'm here to save money. He did say it with a twinkle in his eye, but it is a very important lesson, I think, for all of us to sort of get to, because nobody had talked about saving money. And that's why the IPPF example that I showed is so interesting, that it does show this is the amount of money saving. And the Ministry of Finance is going to be the power brokers much more than, say, for example, Ministry of Health or others. And I think we continually forget to capture, this is not, many of these interventions are not just cost effective compared to the alternative, they are cost saving. And we're not capturing that, and therefore making a stronger case for the Ministry of Finance or even to other development partners. I mean, if you showed that this was actually saving money, it should be able to draw in lots of other partners as well.
Ian, I might come back to you to pick up the question around ensuring all of the stakeholders involved have the capacity to understand which piece of the logic chain is receptive to incentives. But beforehand, Sam, did you want to come in from the Jakarta perspective on the political economy point?
Sure, thanks, Andrew. I mean, I don't think there's any magic answer to the question, unfortunately. I think we all wish there was, but I think, you know, it's a challenge. Like, it's an ongoing challenge to communicate what any program is about, and that includes a results-based financing program. And it's a challenge to really explain both within DFAT and to our other stakeholders what we're trying to do, particularly when we're putting in investments where the results might not be known for a very, very long time, like much beyond one posting cycle, which is DFAT's typical kind of, you know, it's as far ahead as people like to look. So I think it's really difficult. Kirsten referenced before the sanitation HEBA programs that we've tried to run in Indonesia, that, you know, just because of the context, they're really difficult to run, and it's one step forward, one step back. And whilst that's actually just a wicked development problem that we're trying to work with the government of Indonesia on, it also creates huge challenges for us internally to communicate what we're doing. So I don't think I have any solutions to the political economy question, sorry.
Yeah, I think it was a lovely question you asked. I mean, I was based in the Philippines, and one of the problems that was there was that rural roads continued to collapse during the monsoon season. And this had enormous impact in terms of equity and efficiency because it was rural roads and farmers. And the reason why it happened was that the road construction companies were paid on inputs. Have a guess what goes wrong. And this is the classic principal agent problem. So Manila says, well, we're going to pay the contractor to build these rural roads. And they're way out in the back of Northern Samar or somewhere. Nobody's watching. So imagine what sort of rubbish went into the foundations. It's just rubbish. And so the next monsoon season, the roads just disappear. So, you know, how are we going to solve that problem? So the clever part, because this was working in a place like the Philippines, which has a strong media, strong community groups, and exposure. So the lovely part was they said, we'll put out to open tender to that company that can produce, can do the rural road construction. And at the end of the wet season, will independently verify, can the farmers get their stuff to work? Well, shock, horror. I mean, what's going on here? This is all a bit alarming, but it was put out to tender. Some companies did sort of apply for it. And they also very cleverly made sure that the local communities were really engaged in this and watching. And also that the media was going to do a story. Now, the other part that's clever was that the companies and the managers said, we've never done this before, it's a trial. So it could go wrong, but at least you'll be on our side. And so within a few years, you did see that the companies that won the contract said, you know, if we spend a fair bit more money doing the foundation underneath the road, we are going to get all the benefit in terms of the profit, the compensation payment. But more importantly, our reputation, our brand image as being the decent company that did it correctly will go through the roof and we'll get more and more work. End of story. I mean, how good is that? You know, so it was, to me, it was just in a funny sense, low cost, quite simple, feasible, affordable, but it aligned incentives in the Philippines. As I say, they had media to expose it.
Thanks, Ian. Let's go to another round. Yes, ma'am. You first.
Hello, thank you. I'm coming from Indonesia, and I saw what you presented about Indonesia. All the program from TVET was brilliant and helpful for Indonesia. About the infrastructure that you talked about earlier, I want to ask, how about disabilities involved in the program? About the planning, because in the provinces around Indonesia, especially in villages, is there any infrastructure think about disabilities involvement? Because in Indonesia, as you might know, the road is not accessible at all for people with disabilities. And how about the public services, for instance, puskesmas or a clinic, and also the services for the educations can be accessible for people with disabilities? Because in provinces around Indonesia, especially villages, it's impossible for people with disabilities to access any services there. And the second questions, I want to ask about the COVID. How about the economic, sorry, the interpreter's brain is not working currently. Wait, how about the economic can be developed better after the COVID hit Indonesia? Especially for women with disabilities. That's all. 2 questions. Thank you.
Thank you. I'll come to you. They're both for you, Sam, to lead off with, but the gentleman at the back, do you want to ask the next question?
Thanks. It's just, thanks, Ian, for your example there on the Philippines. And I think that what struck me is how fragile some of these investments can be, in the sense that that simple idea of timing the payment after the monsoon could change the whole impact of the whole program. And then also, how do you come to an insight like that? It's not something from an outsider's mindset that we would be able to determine what an appropriate trigger is, understand that local context. And so I think it goes to 2. How do you identify the appropriate trigger? And then also the different incentives that you can create through those triggers, and how fragile they can be in determining the whole outcome of the entire program.
Thank you. So there's a question that wants to build on this. Okay, we'll take one more. Go for it.
Well, I mean, as we all know, in ODA, there's fashions come and go and buzzwords come and go, and trying to be too facetious. But working in RED, I've done a lot of work on RED. It's a results-based system. Most people prefer it to be at the jurisdictional level because of things that can happen. Baselines are difficult at the project level. I've noticed the World Bank, when I heard Valerie Hickey talking about results-based payments in NBS, nature-based solutions, they seem to be pulling back. Maybe I heard it wrong, but there's a lot of, obviously with offsets and international carbon stuff, there's a lot of politics goes on that's got to do with whatever the strategy of people in the environment movement. I mean, there was the Central Kalimantan Forest Carbon Project partnership, that stirred up a whole hornet's nest of criticism, which I think was unjustified by the people that have looked at it afterwards. But anyway, my question is, do you think this is going to expand, be a more increasing thing in ODA? And like you said, as Ian said, it's got a lot of long history with different names. But yeah, I think, yeah, is it the way of the future?
Thank you. So we've got about 10 minutes. Sam, I might invite you to respond first to the questions around the engagement of disabled people's organisations in PRIM, and any brief reflections you may have on, COVID recovery opportunities and Australia's role in Indonesia in that space first, and then I'll come to Ian and Kirsten to respond to the next two questions.
Okay. Thanks, Andrew, and thanks to the audience member for those two really good questions. On the first question, then, really the central way that disabled persons organisations are involved in PRIM is through the road, traffic and transport forums. So these are the forums are actually 50% local government and 50% community members, and they're set up to provide public scrutiny and monitor the planning and implementation of road works. So there's a really strong focus from PRIM on making sure that disabled persons organisations are involved in those forums. Some of the impacts of that has been quite, I've described them as low cost but significant changes to road design, and that includes some of the examples you talked about. So making sure, for example, that in the planning of road maintenance works, that there was prioritisation of roads leading to Puskesmas and education facilities and other things like that. And then just the modifications to roads just to provide more accessibility. I mean, I'll definitely acknowledge in this answer that obviously the starting point is a set of infrastructure that is not accessible, that is generally not accessible. So I think PRIM is sort of starting from a low base, but it does have that mechanism through the road traffic and transport forums. On your second question, I mean, it's a really difficult question. I mean, it does appear overall that Indonesia's economy is, roughly bouncing back from COVID, but I know that there are really significant scarring effects. So there's a real variation in terms of the recovery in different parts of the country and the recovery in different sectors. And so that's going to have different impacts on different groups, on different genders, on people with disability, on different ethnic groups. Australia is doing, partnering with Indonesia in a whole number of areas to try and strengthen the recovery from COVID. But yeah, it will certainly, like a lot of countries, it will still be a long journey to get back to the pre-COVID growth path. Thanks, Andrew.
Great, thanks very much, Sam. Ian and Kirsten, you both may want to weigh in here, but some reflections on the general trend across the donor development actor community regarding results-based financing would be welcome. And then there was another question on, I guess, the difficult art of identifying, the right trigger and landing on the right incentive. Hopefully you've got another compelling example in your back pocket, Ian, that we'll turn to you first.
So in terms of the identifying, this is a good example. So going back to the original problem of the Philippines, the first job is to actually find what in technical terms is called the binding constraint. You know, what is the key single issue that we have to address? So we know that in the Philippines, there are all sorts of companies that can just build a normal road in the rural, in urban areas. Anybody can do that. The binding constraint in this problem was the fact that at the end of the monsoon, the roads were unusable. So that was the binding constraint. And why was it a binding constraint? Because there was very little incentive for the contractors to actually do the right job. Why? Because they were out of sight. They were paid by inputs and nobody was checking whether cotton wool going into the foundation or proper stuff. So there was no incentive and there was no accountability. Incentives and accountability. And so therefore, by attacking that particular issue was the best way to identify this is the approach. And then, and this is the other part that's very clever, to actually trial it. I mean, how much money do you need to apply? Too much? Too little? I mean, this is where you can start to waste an awful lot of money. So you do it in different provinces, et cetera, et cetera. And I have always been influenced by, there's this wonderful economist called Esther Duflo, D-U-F-L-O. Please stand to attention and salute. I mean, she was one of the first women economists to get the Nobel Prize for Economics, and she deserves every bit of it. She's got a fantastic thing on TED Talks of all things, simply called Social Experiments. And so she shows how, if you're trying to, for example, get children immunized, you could provide food to a center. How much food will actually attract people to come in? And by experimenting, social experiments, all ethical, totally ethical, very affordable, you can work out this is the way to pitch it at a level that will be meeting the needs of those people. So I think this sort of Esther Duflo approach of ethical, low-cost experimenting and trials before you start to scale up answers it. And in terms of the mainstream, you know, the future, I mean, I said at the outset, I mean, Asian Development Bank, I mean, those of you who have been around in the 1960s, I mean, the Asian Development Bank was frankly very, very boring, very boring. You know, engineering projects, project enclaves, I mean, it was kind of dumb. It is not like that now. It is really moving to a much more innovative. And as I mentioned, they have a budget of 18 billion United States dollars for policy-based lending for the period 2022 to 2024. I mean, 18 billion for policy-based lending in Asia and the Pacific. This is serious stuff. And I think that is the trend because they realize this is better than old-fashioned project enclave input bureaucratic stuff.
So on your comment, David, I thought, yeah, absolutely. It is all about choosing the right triggers. I think it's all about investing in just really good planning, you know, strategic planning, action planning, road mapping. You can't do too much planning. And once you've done that and you've got that really good foundation, it's easy then to pick your triggers. But to come in without that planning foundation means kind of, yeah, it's risky. And you could do some damage or put the incentives in the wrong spots. On the expansion, I mean, Ian's been doing some research for us. And I mean, I think it's definitely a mainstay of the banks, right? The way that World Bank and ADB operate, Global Fund. Just reflecting on our own portfolio, we've got about 35 at the moment, maybe with 4 or 5 on the pipeline coming through, you know, Timor, Nauru, some work in climate, and AIFFP, our financing facility, is going to start using disbursement linked indicators with its loans. So I would say a gentle increase, but it's not a substantive sort of shift towards results-based financing. I think the key message for us, it's a tool in the toolbox, and it's an important tool, and we'd run, you know, and operating successfully alongside technical assistance and grants and partnerships. Yeah.
Can I just add one thing to that? I mean, I understand it might be a gentle slope. That's fine. However, it's very clear, especially as a country graduates from low income to lower middle income, and then especially from lower middle income to upper middle income, that is a stepwise reduction in the availability of concessional financing, and certainly for 100% grant aid. And so particularly in this region where we've got a lot of countries that can graduate to upper middle income country, it is a particularly scarce resource to get 100% grant aid financing. And what country provides 100% grant aid financing either to the country or to the Asian Development Bank and World Bank? Australia. And so it seems to me that while you're right in saying that it is a gradual increase for results-based financing, the converse is true, is that Australia is going to be increasingly in a sought-after position because we provide 100% grant aid financing untied. So we've got a very powerful lever as these big countries graduate.
So we've got about 90 seconds. I can see there's two very keen questioners. I don't know if you've got a 15-second question that you can ask.
Yeah. So Ian's slide there with the logic chain was quite interesting on picking an intervention point. And one obvious issue that comes up there is that by working with activities, outputs and service delivery, you've still got uncertainty around the downstream outcomes. Do any of these examples that you've had sort of embrace that uncertainty and try and work closer to downstream outcomes and effectiveness? And where you have done so, how do you establish genuine additionality and the counterfactual state of play in those situations? Or is that actually suboptimal? Is it better to focus on getting it done first and then evaluate the impact after? Thank you.
That's a question that I don't think can be answered in 60 seconds. Does anyone want to have a crack?
I mean, Matt's here, maybe you can talk to economic programs, but I think in education, we have linked it to literacy and numeracy outcomes, which is an outcome that we can only measure every 3 years. So yes, I have seen it linked to payments, linked to genuine outcomes. In health, I think there's a lot of international research that it's very difficult around quality of health, but definitely can incentivize access, equity, those sorts of things. But I have seen it linked to things like, increased birth attendance, increased vaccination rates, that sort of thing. So I think you can, it's the way that you design it, and you've got to play the long game.
Thank you, everybody, for such an engaging session. Unfortunately, our time is up. We have to bring this to a close. If you're lucky, our panelists, at least here in Canberra, might linger for a couple of additional questions. But can I thank the audience in the first instance for being so engaged and throwing some really interesting questions to the panel. But can I particularly thank Ian, Kirsten and Sam from Jakarta for leading us through such a great tour of the current landscape of results-based financing. Just to note, much of the analysis that Ian, Kirsten and Sam were drawing on is coming together in a comprehensive report that DFAT is pulling together, and we'll make sure that a public version of that comes out soon. So you'll be able to dive a little bit more deeper into this topic through that. Thank you.